In our modern society, we're blessed with many medications that have increased our lifespans and quality of life. Many chronically ill patients are taking more than 10 medicines a day, and it's not unusual for an individual to take more than 20 pills per day. These complex medication regimes are prone to error. As a matter of fact, recent research studies have indicated that at-home medication errors are at least partially responsible for 25% of all emergency room visits. My name is Terry Mushrush, and I'm a healthcare consultant and the managing partner of the Mushrush Group. In our research, we found significant problems with at-home drug administration. The fact that the problem existed wasn't a surprise, but the magnitude of the problem was really quite disturbing. For example, one study stated that the cost of at-home medication errors equals the cost of all the drugs sold in the United States. Another study was more specific. It stated that these errors resulted in 700,000 emergency room visits, 95,000 rehospitalizations, and 50,000 deaths. Another issue is that patients aren't aware of their own drug schedules. Over half of the patients surveyed in one study couldn't list all of the drugs that they take, and fewer than that could give the dose or the frequency. The situation cried out for a solution, so we developed My Medicine Manager to help people keep track of what medicines they are taking and give them a tool to assist them in taking those medicines properly. My Medicine Manager is a patient-driven, web-based product that addresses medication reconciliation and compliance issues. It uses the internet in a secure fashion, and it links the patients, their family members, and the rest of their healthcare team. With the patient's permission, the healthcare team can build, edit, and view the patient's medication schedule from any internet browser on any phone, PC, or internet device. Each patient is given a plastic identification card and a keychain tag. Both cards include instructions on how to log into the system and a specific identification number. Neither card identifies the patient's name. When logging into the system, the identification number as well as the patient's first and last name are required to access the schedule. The patient controls who has access to the schedule by controlling who has the number and the website information. When medication changes are needed, the schedule can be accessed from any PC and updated by a professional in the doctor's office or by the patients themselves. Once logged into the account, the next step will be to build the schedule. Our system is extremely user-friendly to the schedule builder. Drugs are selected from an FDA database of prescription drugs. They're then categorized by type. My Medicine Manager has 6 categories of drugs that encompass all types of potential schedules. These categories address variability in the dosage, duration, and frequency of the drug administration. Drugs are entered individually, and specific times are selected from pull-down menus. It takes less than 15 seconds to input a drug. When completed, the schedule remains on the central server. When medication changes are needed, the schedule can be accessed from any PC and updated by a professional in the doctor's office or by the patients themselves. At this point, with an accessible, current, comprehensive schedule, many of the issues that are specific to medication reconciliation are solved. In the event that the patient wants to use the monitoring function of My Medicine Manager, with a single click of a mouse, the schedule can be sent via email to the patient's PC or to a handheld device. The program is installed on the patient's device and actively monitors the schedule. My Medicine Manager can run on any Microsoft-based PC that's connected to the internet. The software schedule tracks individual doses of medication, alarming when they are due, and time-stamping each dose when it is taken. This information is uploaded to the central server and is viewable in history reports. The handheld device was developed for those patients that don't have a PC that's connected to the internet. The design of the system takes into account the fact that many patients are not computer literate. It's a touchscreen device that connects to the internet wirelessly when it's turned on. The patient then touches a pill icon on the screen and the system launches their schedule. Patients who are not computer literate have used this system and find it to be very user-friendly. Visual alarm screens will pop up informing the patient that it's time to take their medication and providing them various options regarding that particular drug dose. Patients will disposition that drug by touching or clicking on the appropriate option. Reports are readily available that show what was prescribed and what was actually taken. This information can be used by the healthcare team to improve patient care when altering medication schedules and is vital in case of an emergency. By using My Medicine Manager, the healthcare team has visibility to the prescribed drug schedules and the actual drug ingestion history data. According to the abundant research we've reviewed addressing medication reconciliation and at-home drug administration, this information has not been available in the past. My Medicine Manager is a tool that addresses both of these issues, and by doing so it will improve the health care of those that use it. My Medicine Manager is also very cost-effective. An at-risk population of patients can be put on My Medicine Manager for a cost of 64 cents per patient per day. When you compare this cost to the cost of an emergency room visit, or a rehospitalization, or a stay in an assisted living facility, My Medicine Manager is very financially attractive. It's more than money. Implementing this tool allows patients to take responsibility for their medication schedule and will improve their compliance. This will result in improved patient safety, improved quality of life, and peace of mind for the patient and their families. To recap this discussion, the Institute of Medicine has documented this problem for over 10 years, and there are reams of research addressing the problems of medication reconciliation and at-home drug compliance. We're very proud of our system because it is uniquely positioned to be a cost-effective part of the solution to these problems. I hope you're excited about My Medicine Manager as we are. Thank you for your time, and we look forward to implementing our system with you in the future.